Hello everyone, this is the Fairleigh Dickinson University Respiratory Therapy Lab. I like to call this the Junior Lab because we have many of the basic competencies addressed in this area. For instance, as I swing around, we've got much of the oxygen competencies. As you can see, we're awaiting our oxygen tanks. These cylinders will go over here. We go around. I've got the compressor, which will be hooked up to the H cylinder, which will help power our blenders and our high flow oxygen. And then I swing around. As I said, I like to call this the first year lab. Let me come over here. I'll start over here. These are our competencies in this area. We would begin with, as I use the Butler manual, clinical orientation, medical record review, and then I have a few others. Here we go. Medical record documentation. We're going to use EHR Go, which is an electronic health record. It's excellent, and the students not only will learn how to navigate that electronic medical record, but you can also create case studies for students in it. What do we have? We have infection control, then we have vitals with blood pressure, vitals. Somehow over here I've got trach care only because the table abuts the airway. Now I'll come back to the airway because that segues into the second year. Let me go around back to oxygen therapy. So over here with oxygen therapy, we do have the oxygen analyzer once we get those O2 tanks for measuring blended gas, and it will go over with our blenders. We have different humidification devices, oxygen delivery devices, aerosol generators, different types of aerosol delivery masks. We've got auscultation. When we get into the next room where the stock is, you'll see the student stethoscopes and blood pressure cuffs. Then I come over here to assessment, which is in cardiopulmonary evaluation, and I've got the Easy One spirometer. I've got a small NIF over there for bedside pulmonary mechanics, pulse oximetry. We have a closet with a stock of pulse oxes. Then I do have the EKG machine. Now, as I come around over here, we've got incentive spirometry. To assist the directed cough, I've got an acapella. We've got airway clearance devices in the next room. Over here, I have suctioning, portable suctioning. As I come around to continue our aerosol devices, I do have our medication delivery devices with peak flow meters. We have more stock in the other room. I have the ultrasonic nebulizer here. We're ready for the pulmonary vasodilator delivery. While we can mimic some of it here, but we have the basic pieces. We cannot mimic inhaled nitric oxide, but we can mimic that. And I'm going back to this table before I turn this into another video. I decided to put the airway mannequin in here because it's the bridge in between junior year and senior year. So if our patient fails general oxygen therapy, high flow oxygen therapy, let me swing around, and fails BiPAP CPAP with our 4V60 machines, then they will need to be intubated. And we have our intubation mannequin with different blades, scopes, and tubes.